Welcome to the Irish Practice Nurses Association online educational series for general practice nurses. My name is Teresa Lowry-Lanin. I'm a member of the Carlow branch of the IPNA, and today we will be discussing smoking cessation interventions. The prevalence of tobacco smoking in Ireland has dropped from 23% in 2015 to 15.7% in the first half of 2020. 15.7% in the first half of 2020 shows that further progress has been made when we compare the smoking prevalence in Ireland in 2019, when the smoking prevalence stood at 17.1%. This infographic also shows e-cigarette use in 2019 at 6.3% and at 30.5% for people that roll their own tobacco. This slide shows the reduction in smoking prevalence between 2003 and 2019 and differentiates between the number of female and male smokers. So, for example, in 2003, the percentage of female smokers 25.1% and male smokers 25.5%. And in 2019, the number of shows the reduction in female smoking down to 14.8%, and with male smokers from 25.5 in 2003 down to 19.4% in 2019. This slide shows the overall trends in smoking prevalence between 2003 and 2019. The smoking prevalence in 2003 was 25.3% compared to 17.1% in 2019, and at the end of the first half of 2020, the smoking prevalence in Ireland is now 15.7%. The image on the left in this slide shows the population prevalence and rate of decline, and this can be referenced back to the Healthy Ireland survey in 2019. The smoking prevalence of adults aged 15 or older was 17% at the end of 2019. The current absolute annual rate of decline in smoking, 3-year moving average, is 1.7 per annum, and the absolute smoking prevalence reduction to a tobacco-free Ireland is 12%. Underneath that, it shows the population groups of smoking prevalence, which you may refer back to later. The diagram on the right shows some quitting and supports available from the HSE Tobacco Free Ireland programme and data from 2019. 45% was the number given for the proportion of unsupported equipped attempts. 6,500 was the number of online quit plan sign-ups. 47% was the proportion entering intensive cessation support who had quit at 1 month. On the right of that diagram, it shows 40% for the percentage of smokers making a quit attempt in the last 12 months. The number of quit website sessions per 1,000 people who smoked in 2019 was 295. The number receiving intensive cessation support per 1,000 people who smoke was 11, and the number receiving medication support per 1,000 people who smoke using GMS statistics only was 63. So let's look at the smoking prevalence in Ireland for the first half of 2020. We can see the gender breakdown on this diagram on the left. So for males, 17.5%, and for females, 13.9%. And the age groups with the highest smoking incidence are the 25 to 34 year age group and the 35 to 44 year age group. So let's now examine the smoking prevalence among the different socio-economic groups between 2003 and 2019. On the right, you will see it explains the socio-economic groups from A to F, with A being professional groups, B being middle management executive groups, C1 junior management, C2 all skilled manual workers, D all semi-skilled and unskilled manual workers, E all of those dependent on state long-term and those unemployed for a period exceeding 6 months, and F then being the socio-economic group to which farmers or farm managers belong. On the left, you can then look at the graphs and it shows the different percentages among the different socio-economic groups in 2003, 2011 and 2019. So for example, in 2019, in the AB groups, which are the upper middle class groups, 11.9% smoking prevalence. For C1, it's 14.5%. For C2 group, 18.9%, DE, other working class groups, 21.4%, and F for the group that represents the farmers or farm managers, 12.5%, statistics for 2019. The Tobacco Free Ireland Policy Priority Programme was established in late 2016. Its remit is to mobilise the health service to improve health and well-being and play its part in the achievement of a reduction in smoking prevalence to less than 5% of the population by 2025. The objectives of the Tobacco Free Ireland policy programme are to prioritise the protection of children in all of our initiatives and contribute to denormalisation of tobacco use for the next generation, to support people to quit and treat tobacco dependence as a healthcare issue, and to monitor, build and maintain compliance with tobacco legislation. While much progress has been made, tobacco use is still the leading cause of preventable death in Ireland, with 5,800 smokers dying each year from tobacco-related illnesses. Cigarettes contain over 7,000 toxic chemicals, many of which are proven to cause cancer. Smoking harms nearly every organ of the body, causing many different illnesses and diseases. Smoking-related deaths in Ireland are mainly due to cancers, chronic obstructive pulmonary disease and heart disease. Cancers account for 44% of the disease burden, circulatory diseases for 30%, respiratory diseases account for 25%, and digestive diseases for 1%. Considerable progress has been made to date in implementing the Action Plan for a Tobacco-Free Ireland, including smoke-free zones in public areas, raising the prices of tobacco products, completion of legislation to provide for standardised packaging of tobacco products, the provision of tobacco-free campuses and workshops across the country, proactive involvement of the NGO sector in supporting Tobacco-Free Ireland actions, legislation to prohibit smoking within the campuses of primary and secondary schools and childcare facilities have been introduced. The promotion of tobacco-free campuses and the denormalisation of tobacco, particularly in settings where children are present. Healthcare facilities throughout the country, especially hospitals and primary care facilities, are now tobacco-free. Great progress has been made at many third-level education institutions with the introduction of smokeless and smoke-free campuses, with more centres working towards its implementation. As a nation, we have made huge progress towards becoming a tobacco-free Ireland by 2025. However, there is still a lot more work to do, and reducing smoking rates less than 5% by 2025 is an ambitious goal. In 2019, there were approximately 165,000 fewer smokers than in 2015, and 46% of those who smoked in the past 12 months had made an attempt to quit. 67% had reported health concerns being the prime motivator for their attempts to quit. Being smoke-free can help to prevent 15 different types of cancers, as shown nicely here in the diagram on the left. Smokers are more likely to get cancer than non-smokers, and this is particularly true of lung cancer, throat cancer and mouth cancer, which hardly ever affects non-smokers. The link between smoking and lung cancer is clear. 90% of lung cancer cases are due to smoking. 1 in 10 moderate smokers and almost 1 in 5 heavy smokers will die of lung cancer. The more cigarettes a person smokes in a day and the longer they have smoked, the higher the risk of lung cancer. Similarly, the risk rises the deeper a person inhales and the earlier in life they start smoking. For ex-smokers, it takes approximately 15 years before the risk of lung cancer drops to the same as that of a non-smoker. And for smokers, the risk of contracting mouth cancer is also 4 times higher than that of a non-smoker. Cancer can start in many areas of the mouth, with the most common being on or underneath the tongue or on the lips. So let's now look at the benefits of stopping smoking. After 20 minutes, blood pressure and pulse rate returns to normal and circulation improves in a person's hands and feet. After 8 hours, oxygen levels in the blood return to normal and the chances of heart attack start to fall. After 24 hours, poisonous carbon monoxide gas is eliminated from the body and the lungs start to clear out mucus and other debris. After 48 hours, nicotine is no longer detectable in the body and the sense of taste and smell improves. After 72 hours, breathing becomes easier as the bronchial tubes relax and energy levels increase. After 2 weeks, the circulation improves and walking and exercise is easier. After 3 to 9 months, coughing, shortness of breath and wheezing are reduced dramatically. After 5 years, the risk of heart attack falls to that of a non-smoker, and after 10 years, the risk of lung cancer falls to about half that of a smoker. Life expectancy is only slightly less than those who have never smoked if an individual stops smoking before the age of 35, and stopping smoking before the age of 50 decreases the risk of dying from smoking-related diseases by 50%. The social and economic costs of smoking is substantial and places a huge burden on individuals, the healthcare sector and the wider economy. Tobacco-related morbidity and mortality accounts for over 200,000 hospital episodes annually, with the total cost to the health service estimated to be 460 million. The total estimated cost of lost productivity is over 1 billion. So this infographic produced by Healthy Ireland Survey 2017 and the Youth Smoking in Ireland 2018 shows the attitudes to quitting. 57% of current smokers were thinking about quitting. Smoking rates are higher in more deprived areas than affluent areas. 32% of those living in the most deprived areas were currently smokers compared to 16% of those living in the most affluent areas. Current smokers were over 70% more likely to report distress indicative of probable mental health problems compared to non-smokers, independent of age, gender and social class. And 47% of all who had smoked, shown in this infographic, in those 12 months had made an attempt to quit. The HSE monitors cigarette smoking prevalence and behaviours quarterly to gain a detailed picture of smoking patterns in Ireland and to identify trends. This is useful for informing policy decisions. Roll Your Own Cigarettes in Ireland, Key Patterns and Trends is the first detailed examination of the RYO consumption from the HSE's National Tobacco Control Office monthly survey of smoking prevalence. This research reveals a significant increase from 3.5% in 2003 to 24.6% in 2014 in the number of people smoking roll your own tobacco in Ireland. Note from infographics we showed earlier that in the first half of 2020, roll your own statistics were at 29.3%. CPG Development Group clinical guidelines have been drafted and will be released for stakeholder consultation pending the publication of an evidence review of the harms and benefits of e-cigarettes, which is being carried out by the Health Research Board commissioned by the Department of Health. In the diagram on the left, it shows e-cigarette usage in a survey carried out by Healthy Ireland in 2017, and the usage in 2017 of e-cigarette usage was 7%. In data I've provided you with earlier, we know that the level of use of e-cigarettes in 2019 was 6.3%, and in 2020, for the first half of the year, the data is now currently stands for e-cigarette use at 5.8%. So this shows a current reduction in the use of e-cigarettes. So let's now consider the determinants of smoking. This infographic shows the extrinsic, the intrinsic, and environmental factors that are involved in determining whether a person will smoke. Extrinsic factors include family influences such as parental smoking or sibling smoking and socioeconomic status. Intrinsic factors include a person's belief and values and their personal physiological factors such as genetics, and environmental factors include being exposed to tobacco marketing, images of smoking in popular media, tobacco industry, access and pricing. You may like to refer back to this diagram later for further study. So this image with infographics taken from the Healthy Ireland survey in 2017 shows the interaction and discussions of smoking cessation with healthcare professionals. So for instance, in the previous year to 2017, 35% of people had discussed smoking cessation with a GP, 25% with hospital doctors, 22% with nurses, 10% with pharmacists, 20% with dentists, and 12% with other healthcare professionals. The HSE Quit team provides a support service managed by trained smoking cessation counsellors. The service includes a team of advisors available over the phone, text, email, live web chat, or via Twitter or Facebook. The Quit service is evidence-based and can offer smokers a standard treatment programme where they will be tracked and supported for 12 months. The aim is to make people aware of the ill effects that smoking has on health and provide smokers with the encouragement and help they need to quit. The HSE delivers evidence-based brief intervention in smoking cessation training courses targeting frontline health professionals as per the HSE National Service Plan and Tobacco Control Programme Action Plan. Brief intervention in smoking cessation training is now part of the Making Every Contact Count online training programme. The aim is to increase confidence among staff, to raise the issue of smoking with patients and support those who do need to make a quit attempt. The module takes about 25 minutes to complete. Following successful completion of the online module, you can download a certificate. There will follow an opportunity to complete an Enhancing Your Brief Intervention Skills workshop. Face-to-face training, however, is currently unavailable due to COVID-19. The Making Every Contact Count training module includes an introduction to behaviour change, providing a foundation in behaviour change theory and techniques including the underlying principles of a patient-centred approach. 4 topic modules are available on smoking, alcohol and drugs, healthy eating and active living. A Skills into Practice module demonstrates the skills of how to carry out a brief intervention across a range of topics through a suite of video scenarios using real-life healthcare professionals. The workshops on enhancing brief intervention skills are currently unavailable with face-to-face training due to COVID-19. Other options are currently being explored to support learners to enhance their skills after completing the e-learning programme. Brief interventions for smoking cessation involve opportunistic advice, discussion, negotiation and encouragement, and typically takes between 3 and 10 minutes. The 5 A's of the brief intervention framework are ask, advise, assess, assist and arrange. So with ask, it's systematically identifying all smokers at every visit. Record their smoking status, the number of cigarettes they smoke per day or per week, and year they started smoking. In advising, we should encourage all smokers to quit. Advice should be clear and personalised. In assessing, determine the person's willingness and confidence to make a quit attempt and note the stage of their change. In assist, we aid the smoker in quitting. We provide behavioural support. We can recommend prescribed pharmacological aids. If the person is not ready to quit, we can promote motivation for future attempts. And by arranging then, we follow up with appointments within 1 week or refer to a specialist cessation service for intensive support. The Tobacco Control Programme and the National Cancer Control Programme have also developed a 30-second quit smoking guide for health professionals. It's a simple A4 card to be used by hospital and healthcare teams when they are caring for someone who is a smoker. The aim is to ensure that all patients are asked if they smoke, and if they do, that they are offered support to quit and prescribed medications to help them if necessary. The 30-second quit guide is available for health professionals at www.healthpromotion.ie. So let's now consider the role of the practice nurse. All healthcare professionals have a part to play in promoting smoking cessation and working towards a tobacco-free Ireland. Smoking cessation interventions, including pharmacotherapy and behavioural change interventions, increase smoking cessation. The use of visual, behavioural change and motivational aids such as the Smokalyzer, which is a non-invasive measure of blood carboxyhemoglobin levels, and the Stages of Change model help to support participants and enhance successful outcomes. Non-nicotine pharmacotherapy has been clinically proven to stop smoking and is effective and has a very good success rate. It is important as practice nurses to provide effective smoking cessation measures for all smokers at each clinical visit. Adding smoking status as a vital sign at consultations provides a framework by which the use of tobacco products can be confronted by clinicians. Using brief interventions for smoking cessation, which is the 5 A's, ask, advise, assess, assist and arrange, with all smokers, incorporates smoking status as a vital sign and ensures that smoking cessation programs can be offered to all who require it. Once aware of the smoking status of our patients, general practice nurses can focus on moving smokers from the stage of contemplation to making an attempt to quit. Smoking cessation interventions promote the Department of Health Tobacco Free Ireland by 2025 policy under the Healthy Ireland framework, and it empowers individuals to take a level of responsibility and control over one of the modifiable determinants of their health. Practice nurses play an essential part in the delivery of quality primary care. Through communication, advocacy, counselling, assessment, monitoring, audit and evaluation. We lead on quality improvement initiatives and research. Smoking is a significant determinant in the progression of COVID-19, and now more than ever it is important to take action to protect the respiratory health at a population level. Preventing tobacco initiation and helping those who do smoke to successfully quit is the single most effective way of achieving this. This is a list of the references that were used in the production of this presentation. I hope you enjoyed this presentation on smoking cessation interventions, which is part of an online educational series for general practice nurses produced by the Irish Practice Nurses Association. My name is Teresa Lowry-Lanin. I'm a member of the Carlow branch of the IPNA. Thank you very much for watching and listening.